Hi, everyone.
Hi.
Hi. That's awesome. Are you guys volunteers or nice to thank you for coming?
Yeah, no.
Okay. Well, my name's Alison Freeland. I'm a psychiatrist. I work at Trillium Health Partners. I do clinical work in our eating disorders clinic that's there, but I'm a general adult psychiatrist, and I'm really pleased to be here today to talk about three main things. I want to talk a bit about mental wellness. Then I want to talk a bit about burnout, which is a very common thing that I think people talk about. And then at the end, I just want to highlight some signs and symptoms of mental illness and when we should be thinking about how to help people access support and care. So it's always great when we start talking to think a little bit about some definitions. And so the first thing I just want to throw out there for us to consider is, what is health? Has anyone got a great definition for health? When you feel good? That's a good one. Yeah? Anyone else? Take a go. So I think one of the things when we think about health, people kind of focus on health being the absence of physical illness. And in fact, that's only a very tiny part of being healthy. Being healthy is actually about, in a complete way, feeling physically and mentally and socially healthy and complete. And that's what makes us feel healthy overall. And it's important to think about that because in healthcare, a lot of the time we spend a lot of time thinking about physical health and physical symptoms and how do we stay well from that respect. I don't think we spend nearly enough time thinking about how we maintain our mental wellness and what are some of the steps we can do individually to ensure that we are staying as mentally well as possible. So I'm going to run through a few things. My slides are so low tech compared to the previous physicians, but I'm a psychiatrist. We have no equipment in psychiatry. We just do a lot of talking and showing slides and trying to get people to think about themselves. So I've got a list here, and when you look at this list, you're going to say, why does this woman go to school for nearly 10 years to come up with this list? Because it sort of sounds very common sense, right, when you think about these things. But I actually spend a lot of time when I see my patients going through these things because these are actually been shown through research and evidence to be the most foundational things we can do to stay mentally well. The first thing I'm going to talk a bit about is sleep hygiene, which basically means how do you sleep really, really well. And I think one of the number one errors that people make about sleep, and I'm going to ask you to put up your hands if you do this, is you have a really busy week, you're at school, for example, you're studying, you're staying up till 2 at night, you got to get up, 7 o'clock the next morning to get to class on time, and then you think, the weekend's coming up, all I need to do is bank some sleep. I'm going to stay in bed till 1 o'clock in the afternoon and crank up that sleep and get a good 10, 12, 14 hours in, and then I'll be fine. That's actually one of the worst things you can do for sleep hygiene, and I'll tell you why. Our brains learn a certain way of sleeping, and the more that we can do exactly the same thing every night to produce healthy sleep, the better we're going to be from a sleep perspective. And so the number one thing you have to do when you have difficulty sleeping or your sleep feels a bit out of routine is set your alarm clock and get up at the same time every morning, 7 days a week. And don't sleep in on the weekends, because every time you sleep in on the weekend, you're going to stay up late at nighttime, it's going to be harder to get to sleep the next night, and then your sleep begins to deteriorate. And one of the things that we find when we're not sleeping well and we're tossing and turning is that your brain learns that when you're in bed, it can just stay awake, it can think about the exam the next day, it can think about the stresses that you're going to have. It doesn't learn to shut down and kind of condense its activity into sleeping for a good 8 hours. 8 hours is a good amount of sleep to get at nighttime. If we can all aim for 8 hours, that would be awesome. But you've got to work hard to get that practice in to hit 8 hours. Really, really important. The other thing about sleep hygiene that I just want to say is, how many people, when they can't sleep, pick their phones up and start scrolling? Sean Chug, I knew you would put your hand up. And you, Sean Kerr. The Seans. And that is the other very worst thing you can do, because the light that comes off that screen is stimulating your brain and it's creating a very unhealthy awake period that's going to be even harder to get back to sleep. So you get sucked into a Netflix show, you're doom scrolling on whatever it is you're looking at. Those are the things that are going to continue to keep awake at night. So two main things: get up at the same time every morning and keep that phone out of hand reach so you don't pick it up when you wake up. If you do wake up at nighttime and you spend longer than 20 minutes not being able to get back to sleep, don't stay in bed. Get out of bed, try and go to another room, sit quietly, listen to some very calming music, have chamomile tea or some warm milk, stay up for half an hour, and then go back to bed and try again. When you lie in bed tossing and turning, it's again training your brain that it's okay to be awake in bed at nighttime. So let's move on a little bit to nutrition and exercise. We've heard from some of our other awesome speakers today the importance of that for lung health, for heart health. Well, it's good for your mental health as well. And exercise in particular has been shown through research to actually be treatment for mild to moderate anxiety and mood disorders. And so for people who have anxiety and maybe depression, making sure that you're having that regular 20 to 40 minutes a day of some exercise, even if it's gentle walking, early in the evening so you don't stay up awake because you exercise too late. That's actually very good for your mood and for helping with your concentration and your focus and decompressing from stress. Another thing that's really important to do is actually have check-ins, both with yourself about how are you doing mentally and with friends and family, asking them how they think you're doing as well. We spend a lot of time rushing around these days and not really sort of thinking about how am I feeling, how am I doing. But many of us go through a series of different feelings and emotions during the day, and if you don't stop and think, why am I feeling kind of cranky right now? Why am I feeling a bit irritated in the meeting that I'm sitting? Is it about the meeting? Or is it actually got to do with me and how my day is going right now? And so taking a couple of minutes to ask yourself that question, how am I doing? How am I feeling? And is there anything that I can do differently to try and adjust that is a really important thing to do. Make sure that you don't just check in with yourself all the time, though. Ask a really good friend, hey, how do you think I'm doing? Have you noticed anything unusual, or how am I doing in terms of school and stuff? Ask other people to give you some feedback about that. Quiet time is really important as well. Most people can kind of get divided into two things. They can be extroverts. So extroverts are often people who get some energy from seeing friends, doing more activities and being around people. Some people are introverts, and they actually get energized by spending some downtime on their own, doing things that they like to do and feeling quite good with their own company. But in both those situations, all of us just need a little bit of quiet time, even if it's 20, 30 minutes, 3 to 4 times a week, where you just sit with yourself. You're not doing a whole bunch of activities, but you're letting your body and your brain and your feelings decompress a little bit. So making sure that you're doing that regularly has been shown to be very helpful. In addition to quiet time, spending that time with your friends and family, making sure that you're not too busy, running around at work, being part of sports teams and all the other things that are keep people busy during their weeks. Make sure you're just spending some quality time with friends and family, talking, kicking back, having a bit of fun is really important as well. Scheduled regular vacations are also really important. And vacation time is not time when you just say, for my colleagues, I'm going to go to a conference and be really busy racing around doing that. I can see everyone in the back row thinking that. It's actually, that is not vacation time. Vacation time is when you're not in school, you're not doing work, you're actually taking time away somewhere, doing something that feels good, you're learning, you're being and doing in a different vibe, and that's actually helping your mental health as well. Learning to say no. We all get asked to do a million things these days, and sometimes there's that sense of kind of FOMO. If I don't say yes, I'm going to miss out on the best opportunity of my life. Well, actually, we can't just keep gathering up these opportunities. Sometimes you just have to say, how am I doing? Am I feeling tired? Have I reached a limit? This time, maybe I just need to say no and not take on that extra thing and feel committed again. It's okay to say no. There's going to be lots of things that happen in life that are opportunities, and saying yes to some and sometimes no to some is totally fine, and it's a great thing to be able to learn how to say no. The final thing I'll just say is, even though many people feel mentally healthy, it's always good to know in your back pocket where are your mental health supports. And those mental health supports are both your informal mental health supports and your formal mental health supports. Because there may come a time where you're getting super stressed or life is just getting pretty tough, where you need to know, who is that person I pick up the phone and call and say, I'm just not feeling great right now. I need to have a chat. Can we go for a walk? Can we go for a coffee? So you don't have to kind of think about that on top of everything else. You've kind of got that person that you know to call. And the same thing is with having your family doctor, or there's a counselor that you know, or you're aware of a great community agency like the Canadian Mental Health Agency, having those numbers handy if you're feeling overwhelmed and stressed. It's almost like having a preparation kit for, I'm feeling pretty mentally good, but I know what I'm going to do if I don't feel so good down the road. So that's about mental wellness and a few tips around focusing on how to stay happy and well. But life is hard, life is busy, your own personal lives, what's going on in the world right now, it all feels pretty overwhelming and stressful a lot of the time. And one of the things we know is that repeated exposure to stress or experiencing an intense stressor can lead to burnout for many, many people. So I just wanted to talk a little bit about burnout because it's a word all of us use all the time. You know, I feel burned out, I feel overwhelmed, but what does it really mean? The thing about burnout is it's not actually a mental illness to have burnout, but it's almost like your body and mind starting to throw up some red flags saying, I'm not doing so great and I need to do something about how I'm feeling right now so you don't progress to having a mental illness. And burnout is really, and I'm going to read this here because it's a great definition, it's the physical, emotional, or mental exhaustion which is accompanied by decreased motivation, a lowered performance in what you're doing, and constant negative attitudes towards oneself and others, and it often comes from prolonged or repeated stress. And so it's a feeling that every day you get up, you're kind of feeling, oh, I just don't want to get out of bed, I don't want to go to work, I don't feel like I'm doing a great job at work, everyone at work is kind of annoying me and I don't want to speak to them. You feel tired, you've got headache, you feel tense, feel irritable. All of us may have the odd day feeling that way, and that's kind of normal, but if every single day you're getting up and feeling that way, you have to think about the concept of burnout and what you might do to adjust what's going on in your life that may help you relieve some of that strain so you can get back to a state of mental wellness. So these signs are important to recognize, that idea of excessive tiredness. It takes longer to get things done during the day. You just don't feel enthusiastic. And your friends might say you're not doing as well, your marks are dropping a bit in school, or your boss at work is saying, hey, it's taking you a bit longer, what's going on? Just feeling that sort of pessimistic view, drained and emotionally overwhelmed, and sleep doesn't relieve that. And often those physical symptoms of headache and tension. So when you feel that way, that's the time when you've got to pull out that number that we talked about before and say, something's going on with me, I need to talk it through, I need to figure out what that stress is in my life, and what do I need to do to feel better. So what sometimes can happen, either as a result of burnout that's not being relieved, and so that stress keeps building more and more over time, or sometimes just out of the blue, people can get mental illness. And I just want to talk a little bit about some of the things to look out for, both in yourself and if you've, your loved ones, thinking about them. What are some of the signs you might want to see and get worried about that you'd want to get somebody in for an assessment and some help? The other thing I want to say before I go through this list very quickly is that mental illness can happen to anyone. It's not anyone's fault that they get mental illness. It's sort of like you get diabetes, you get hypertension, you get cancer, these are illnesses that people get. They can be genetic with stress on top of them. And they can come as a result of all kinds of things that go on in people's lives. But mental illness happens to many people. 1 in 4 to 1 in 5 people will get mental illness. They often start when people are young. In childhood, in adolescence, we begin to see people developing early signs of mental illness. And usually with some of our more severe mental illnesses, by the time somebody's in their late teens and early 20s, we begin to see that manifestation and impact of somebody having a mental illness at that point. So what are some of the things to look out for? The signs I'm going to talk about, again, are not things that happen for one day and then they go away. These are sustained signs that are there for at least a week to 2 weeks for mood disorders, for longer if it's a psychosis. And those are the things that you need to look out for. So for people who get depressed, there's a lot of sort of physical symptoms that we can see. People can have very disturbed sleep. They have difficulty, often they can fall asleep, but they wake up very early in the morning and can't get back to sleep again and feel quite sort of de-energized and stressed and unwell during the day. There's often significant appetite changes, and so people can either completely stop eating, or sometimes people start eating excessively as part of their mental illness. How people care for themselves, how people, do they take a shower every day? If somebody stops showering or bathing, are they not changing their clothes? Are they not doing their laundry? They're not going out to get groceries in order to look after themselves. That sustained change in personal care is something to look out for. Dramatic changes in mood, so somebody's suddenly very depressed, or suddenly they seem very elated all the time and kind of irritable and too on top of the world. You can see both types of mood disorders in mental illness, and looking out for that is also important. A change in functioning, so not doing well in school, not going to school, that's a very common sign we see in adolescence where people might be beginning to struggle with their mental health. Having difficulty at work or not engaging well in social activities or all, in a sustained way are all warning signs as well. And not being able to concentrate or pay attention or having difficulty with logical thoughts are also signs of mental illness as well. People sometimes get worrying signs which include having a start of unusual thoughts, which when they share with you, they just don't seem to make sense. It seems illogical. There may be some paranoia or suspiciousness that doesn't make sense. And sometimes we worry that those can be early signs of a mental illness like psychosis. And in that sort of situation, you might see odd, uncharacteristic behavior, acting strangely, etc. And then finally, sometimes when people are really struggling with their mental health, people will express thoughts of harming themselves, or they may even talk about feeling suspicious of somebody and wanting to harm that person. And in those situations, we really, really worry. We want to ensure that folks that are having that level of symptomatology are seen quickly. If somebody really seems agitated or unwell, that's a time to call 911, pick up the phone, bring somebody to the emergency at the hospital. And we want to really help people try and figure out what's going on to prevent an unfortunate unintended consequence of unrecognized mental illness at that point. So that's a little bit of the tour I wanted to give today about mental wellness and what you can do to stay as mentally well as possible, how to recognize the signs of burnout, which many, many people get, and some of the steps that you can take to intercede there and get back to a state of mental wellness. And then for mental illness, what are the things to look out for and what can you do about that? And so my last slide here is just a couple of resources that I have here. Feel free to take a screenshot if that's of interest to you in terms of the community. The one I will point out to here, which is very helpful in Peel, is the quick guide. It's on the website for the CMHA Peel Dufferin, and it has got a very long list of all kinds of community-based resources for people. Many of them are self-referral, so if you're worried about yourself or you're worried about your buddy, you can look through those resources and call and find out how you can get somebody connected to some help, which is probably one of the best things that you can do. And the last thing I'm going to say is, if you see somebody and they're not doing well, ask. You know, a lot of us get worried about, if I ask, is that going to make them worse? Are they going to get angry with me? If I ask people if they've got thoughts about hurting themselves, am I going to tip them over the edge and they're going to hurt themselves? What has been shown is that when people reach out and ask how somebody's doing, it can be as simple as, hey, how are you doing today? It looks like you're having a tough day. It's a very easy sentence to say, and it can be some of the most helpful things you can do for your friends and family, just to reach out and ask that question, because that's the invitation for somebody to share that they're not doing great, because many people feel stigma about mental illness and they feel scared to share that. But if you show interest, you ask that question, and even if you don't know what to do, you say, I'm not sure how to help you, but I'm going to help you figure out how to do that, and call one of these numbers. That's the most important thing that you can think about doing from this perspective. So thank you so much for listening to me today. I hope you've learned something, and if you've got any questions, happy to hear them. Any questions? It's like the Lucy booth in Peanuts. It's the psychiatrist is in, so happy to answer any questions. Anyway, as you're walking out, I'm going to stand here, but thank you very much.